My name is Riham Zein. I have a pharmacy doctorate degree and a PhD in pharmacology. I graduated from the University of Houston, Texas. After that, I pursued a clinical pharmacy degree. I worked in some of the largest hospitals in Texas, Houston Methodist Hospital. A few years later, I moved to work at Sunrise Hospital, and now I'm currently practicing with Kaiser Permanente with LA Kaiser. I am triple board certified. I currently am board certified in pharmacotherapy, infectious diseases, and critical care medicine. Every day I thrive to provide evidence-based medicine and the most safest and effective therapies to my patients. Because I care about changing lives and patients to live better quality of life and live longer, not just live forever, but how they live, the way they live it. And Age Code provides a lot of insights to the patients about how they're aging and how their organ systems are doing. And they also provide risk stratifications and next necessary steps that the patients can take to discuss with their physicians and make the necessary plans to prevent disease progressions, treat diseases, and make better choices about their lives. And with me, I find that genetic lifespan, not only it's a precision wellness company, it also has true clinical validation. And as a healthcare professional who also holds a pharmacology PhD, I care about practicing evidence-based medicine, and I want to do ultimately what's been studied and scientifically proven to my patients. PGX is, so the way I see it is the future is precision medicine. So healthcare is moving beyond one-size-fits-all medicine. What ultimately I would love to see as a healthcare practitioner is to be able to use patients' individual genetic maps to help guide us as clinicians to design therapeutic treatment plans and ultimately do what fits the patients based on their epigenetics, based on their lifestyle, environmental changes that they have, and ultimately make healthcare and medicine more predictive, more preventative, and more precise. I practice a lot in the intensive care unit or critical care medicine, right? Patients ultimately very often come to us when it's too late. Sometimes they know about their diseases, sometimes they find out new information that they never knew from the past. I find that genetic lifespan provides a lot of insights for patients about how they're doing and all the variables and the methylation biomarkers, which gives the patient a better control about what changes they can make about their health and life choices. They also provide you with information in a very easily read report, what changes you can make to live longer and ultimately live healthier. With the directions that we're leading to is to utilize how patients' genes affect the response to medications, correct? So not everybody absorbs medications the same way or they respond to the medications the same way. So we cannot use one size fits all. By using patients' genetic information, we can actually design, so you cannot, for example, treat patients that needs blood thinner with the same blood thinner at the same dose. Patients that have epigenetic variants or genomic variants, they might respond differently depending on the medications you're using to treat a specific disease. So by ultimately tailoring that information and using the right dose, the right treatment ultimately to the patients, you're making a lot of positive outcomes and you're affecting patients' life in the right direction.